in my current role as a support worker lead, it's trying to unpick and identify what's available to the support workforce. So I've put a number of different AHP support workers through different apprenticeship routes, supported them to do other elements of the job, so leadership, and kind of understand that while sometimes there might feel like there's a hierarchy in support workforce, they're probably one of the most valued workforce that we have. They're that core, that centre to everything. So being a leader at every level is really important to me, and giving them the confidence to be able to feel like they have a voice in a lot of the decision making in a team.
So I'm lucky enough that I get to do half physio, half OT. I get to see a great variety of patients with different issues that they come to us with, and see them throughout their journey to rehabilitating them back to health. It's such a worthwhile job. It's really rewarding, it's fun. No day is ever exactly the same as any other. There are obviously positives and negatives, but the positives absolutely outweigh, definitely.
We work in the acute assessment unit and the emergency department, and what our primary role is supported discharge. I had a past life in the NHS as a therapy radiographer treating cancer patients. This is a complete change. What this role's given me is an insight into acute therapies, ward work. I never had any experience with that in my previous job.
I'm a radiology assistant. I've been doing my job about 18 months. I'd like to be ideally a physiotherapist, so I like to go into that side of a hospital team. I suppose it's prepared me cause the types of injuries that you see in X-ray. So then on a personal level, I'll think and research what kind of physio they could have to help them.
I'm a physiotherapy apprentice. So I'm studying to be a qualified physio, but during the week I work as a therapy assistant. It can be very rewarding, you know, when you see someone, especially on more the trauma ward where someone's really struggling, and if we get to spend quite a couple of weeks working with them, you can see the progression from, you know, taking a couple of steps to, you know, walking around independently. I think that's a really nice feeling to see.
I only started in January, and I've never had any experience in therapy before. I've been in healthcare for about 5 years, but yeah, everything is new to me. I'm still learning now. I definitely don't know it all. Now I'm doing the apprenticeship to get my level 3, and then hopefully do the apprenticeship to become qualified physio or OT. But at the minute, I'm still learning, still getting my apprenticeship and my qualification. No regrets. I have come down the ladder a little bit, but it's just career progression from here, hopefully.
I'm the speech and language therapist assistant. I love seeing the difference I make for patients, even if it's just learning how to give somebody not necessarily a voice, but a way to communicate. So just making that, even if they can do a gesture, if they can raise a hand, if they can, some way that they can communicate, that's my main role. So on a morning, we get together as the team and we go through every patient and referral that's been made. We talk about every patient every day, where they're at on the therapy. They all have goals which are set and changed on a weekly basis, depending how they've progressed in their journey. And then we are allocated patients to see. So I concentrate on the communication patients. I absolutely love it.
So trying to explore new roles that can give support workforce different opportunities. It doesn't have to be one clear route. It's giving them different options depending on what their career pathway is, their talent, all those other elements. So just trying to give as many options as possible and continue to change as the NHS changes with it, I think.